labyrinth. From the outside, the goal is clear, and a preliminary choice among the possible routes is easy. However, once inside, the traveler finds himself with a bewildering choice of routes, which seem to lead in the right direction. Only experiment will uncover the fruitful path. In this program, we'll travel just such a maze and see where it led. The product under consideration is a new membrane filtration material for the pharmaceutical industry. Customers had expressed a need for a new product, a product that would meet the daily challenges of industrial use. They were beyond the limits of available products. The pressures felt by Dr. Robert O'Connell of Merck Sharp and Dome were typical of problems faced throughout the industry.
I'm going to say just about everything that we do in the biological business is dependent at one stage or another upon sterile filtration. Many of the components of the vaccine or of the systems that we handle are not capable of being heated, the vaccines themselves, and therefore they have to be sterilized through filtration. So without sterile filters, our job would be much more difficult than it is. In the past, it has been the practice to say that we have used the filter in a certain process for a long period of time, and the product that has come out is acceptable. That's no longer a valid approach. You now must prove that the filter, under all conditions, is capable of producing a good product. And therefore, validating the process, including the filtration step, is important to prove that under any conditions your product will be acceptable. The most convenient way to do that is through an overkill process where you autoclave the filter holder to a time and a temperature which will kill the most resistant known organism. This will then make the sterilization process acceptable for any other bacteria that may be present. The temperature required to sterilize an item is close to the temperature at which the filter is deteriorated. So you were treading a line between sterilization and filter integrity. I think the ideal filter is one that's indestructible from a heat standpoint, is reliable in the sense that you can use it and can depend upon it retaining its integrity, and is convenient to use. The more can be that it is being used right.
We have to consider that all these systems, once they've been evaluated and have been put into production, are going to be handled by operators on a 3-shift basis, where they're going to have to be changed and handled in an aseptic manner. This has to be taken into consideration when both you determine what type of housing you're going to use, what type of cartridge you're going to put in it, what kind of abuse it's going to be put to into the system. Here, a pleated cartridge gives you a much smaller housing and a much easier installation. It's better all around.
Like O'Connell, Dave Crossan, manager of crystalline operations at Wyeth Laboratories, saw a need for a thoroughly redesigned product.
I'd also like to see filters that were capable of standing small amounts of back pressure. This quite often happens, especially in steam sterilization. Even during filtration, that you might have a slight back pressure on a filter. It's important that we maintain this integrity of that filter throughout that filtration process, and if at any time we should have a slight back pressure, I think the filter should be able to withstand it.
A definition of what the market needs and a set of development goals are the cornerstone of product development and must be laid very early to allow for the long lead times research and development require. At Millipore, Senior Vice President Jim Dwyer is in research. A project to develop new membrane structures was already underway in 1975 under the code name LifeX. In that year, Dwyer gave the program new impetus by sharpening the goals and directing them toward the developing requirements of the pharmaceuticals industry.
We've made experimental filters out of all sorts of things. We've made filters out of styrene. We've made them out of threaded cellulose, nylons, polysulfones, what have you. Yes, we certainly had produced structures, but set with these kind of criteria that were emerging, what did we really need? And I think we saw several things that we really wanted to have in filtration products for the pharmaceutical industry. We wanted to have a material and a membrane manufacturing process that was consistent, easy to reproduce as far as we were concerned, with very tight controls on a day-to-day basis. We certainly had that in the cellulose esters, but in the other processes we would have to have that equal ease of reproducibility. We wanted to have excellent chemical stability, virtually no degradation or breakdown of the filter itself. We wanted to eliminate extracting of any soluble materials from a filter into a product stream. We wanted to have high temperature resistance, the ability to withstand prolonged sterilizing or multiple sterilizing cycles. We wanted to have very good physical properties. The finished product had to be able to be handled by workaday production people and schedules. We really had to be able to take increased hydraulic stresses and strains and the pounding of turning valves on and off and things like this. So we really had to have a tough filter material that was going to guarantee its integrity through these kind of rigors.
With some preliminary research already done, a scale-up of activity now began. Major development responsibility passed to Mookie Sternberg. Completing the project would require the coordination of a variety of efforts, and most of all, it seemed, on learning from the setbacks.
Having all these criteria, we screened all the polymers available in the market, and we picked the one that obviously was answered the widest spectrum of our criteria, and we had a little bonus. We thought that that particular polymer could even be inherently hydrophilic. However, this particular polymer could not be made into a filter using our conventional technique or techniques here for the microporous filter we had been making. We had to develop a whole new technology, and obviously it took a lot of manpower, a lot of time, but eventually we developed the technology to make a microporous structure out of that polymer. At that point in time, we found that the polymer was not hydrophilic enough to be wettable. That required a new effort now, which was equivalent in size and magnitude, to try and make it permanently hydrophilic. We were successful even in that. And eventually we had a filter, a microporous filter made of that polymer, which was permanently hydrophilic. At that point in time, we received an announcement from the manufacturer of the polymer that that particular polymer is no longer commercially available. We probably could make this polymer or have it made for us and continue and make this filter. But knowing what we know about polymer synthesis and making small batches of polymers, we knew that we will not get the consistency in the polymer that you would get when you buy from a large manufacturer making large batches and lots and master lots. We cannot afford to have such variation in our products, and we decided that with all the good work that went into it, We could not afford to make a polymer, a filter from a polymer of this kind of possible variations. And sorrowfully, we decided that we had to start from scratch.
In pharmaceutical manufacturing, bacterial retention would be a key parameter. About the time the LifeX work was coming to a head, the microbiology research group was involved in a detailed study of diffusion flow testing. Microbiologist Tim Leahy was developing and refining a package of tests and concepts which would prove useful in the Durapore development program. First was the beta ratio, the number of organisms used to challenge a filter divided by the number of organisms found downstream of it. The beta ratio correlates well with diffusive flow over a range of differential pressures and at the bubble point of the filter, giving a quantitative measure of a filter's ability to hold back bacteria. But was the passage test performed in a realistic way, one that would reflect worst-case conditions in actual customer applications? This became another focus of the work. The test apparatus, the manipulations, and the organisms in their culturing were all studied closely and rigorous protocols developed to assure optimum results. Although this work was done with conventional cellulosic filters, it would be useful in the development work on Durapore as well.
This early work that we did trying to establish the relationship of beta ratio to bubble point has had an important consequence beyond just looking at how reliable or how predictable a membrane filter can perform bacteriologically. It also gives you a way of assessing a new membrane material, a material that has unknown properties, totally unknown bacteriologic properties, never been tested before. By establishing that there is a relationship of beta ratio to bubble point, okay, you can then, based on the relationship that you develop, predict at what bubble point you want to manufacture a filter so that you get some margin of safety, some level of assurance that a membrane filter will hold back the bugs that you expect to hold back in actual use. So the value of the beta ratio goes beyond just proving that membrane filters are quantitative, reproducibly quantitative in removing bugs. It also gives you a way of focusing or fine-tuning a physical property, knowing that there is a relationship of that physical property to a biologic property, a bacteriologic property. It also aids people who have to make decisions about what kind of physical properties a filter's got to have to hold back bugs. It gives them some way of making an intelligent decision about whether it is not an arbitrary decision, but an intelligent decision of how to tell you're getting a sterile effluent.
Meanwhile, the Durapore project entered a new phase known within Millipore as VMF. After a brief search, attention turned to a fluorinated polymer with many of the characteristics of Teflon. Polyvinylidene fluoride is a semi-crystalline polymer with excellent resistance to acids, good resistance to bases at ambient temperatures, is pliable and treatable, and heat tolerant. This new candidate showed high promise. The labs were able to prepare filters with the pore sizes, flow, and bubble point that were sought. One problem remained. Like Teflon, polyvinylidene fluoride is extremely hydrophobic. Two approaches to overcoming this drawback were tried. One was to treat the base material with a surfactant. The other was chemical modification.
People will tell you that modification of a fluorinated polymer is not the easiest task there is, and chemists don't really run after jobs like that. It's tough. But there we were. We had a good filter, excellent filter, which was made of a polyvinylidene fluoride and was hydrophobic, and our job now was to make it hydrophilic, permanently wettable. We had no idea how to do it, and we got together and we thrashed it around, and there was one particular idea that we liked, and we said, well, we'll try that one. It required a particular molecule that will have the right properties, and we went and got that particular molecule. And we ran our reaction. The filter changed colors. I said, terrific, we have a reaction. It didn't wet. At that point in time, we had to decide whether our idea was wrong or was it the wrong molecule. We decided to give our idea another chance, and we went out, and with a little subtle change in the structure of the particular molecule I'm talking about, we reacted the filter again. We had the same change in color. Reaction took place. We tried it now, and it worked.
Work continued now on two parallel paths. Chemical modification of the polymer was known as VMF2, while surface treatment was known as VMF, or VMF1. Both approaches were producing product close enough in key parameters to the final product that other sections of the company began to enter the project. The Process Filtration Development Group, under manager Pete Ryman, would have responsibility for fabricating cartridges out of whichever version succeeded.
The beginning, for me at least in this area, was probably a good 2.5 years ago, when the Durapore filter was not very much more than a laboratory curiosity. The first short, continuous lengths of something resembling a true membrane filter were just beginning to come forward, and we were asked to take a look at the characteristics of the material to get an idea of whether it could be fabricated into expanded area, pleated configurations. We had what appeared to be a very unique new material, extremely flexible, all kinds of promise held for being able to fabricate it. I think I have a sample here of one of the very first casts of the Durapore material, and if you look at it, you can see that it's easily folded, creased with the fingers, folded back on itself, and you simply don't destroy the structure. We're one to do that with a standard mixed cellulose ester filter. You'd find that it would break very readily. It's extremely flexible. You can crumple it and not do great damage to it. But by the same token, it's deceptive, because the structure is in fact about 80% air, and it suffers from a number of the same kinds of problems that any membrane would suffer from. Its tensile strength is not terribly high, it is vulnerable to impact, and it can fail. So we had a challenge.
Ryman assigned major responsibility for Durapore cartridge development to Mo Akamozo, designating him project leader. Mo's first challenge was how to support the pleated VMF material. Traditional support materials produced a malady known as gaposis. A gap between filter and support at the bottom of the pleats allowed the filter to blow out under extreme differential pressure. To detect more subtle failures, a vacuum was applied downstream to draw paint through the cartridge. When the cartridge was dissected, even microscopic leaks were pinpointed by the paint.
But then as we tried to go through and utilize different support materials to comply with non-fiber shedding material, non-particle releasing materials, we found that each one of these support materials had its own pleating characteristics that we had to learn to deal with. And I think we went for about a 6-month period where the number of successes were very few. One of the other things that was happening simultaneously was the membrane was also being developed as we were developing the cartridge. We were on parallel paths, and what this allowed us to do was to feed back to the membrane developers some information as to what kind of properties we'd like to have in the membrane.
VMF2, the modified polymer, was now passing every test except one. Once autoclaved, it would lose wettability. Nevertheless, chemical modification remained the preferred approach. Meanwhile, the surfactant technique was also showing results. The first surfactant tried had foamed, but pluronic, a surfactant generally acceptable within the industry, also worked. Samples of VMF treated with pluronic were submitted to Dr. Chris Jansen's Laboratory Services section for analysis.
Well, the problem with the surfactants was shelf life. Without stabilizers, the surfactants would become hydrophobic while setting on our customers' shelves or setting in inventory, or occasionally would not survive autoclaving and would become hydrophobic after autoclaving. While none of this would ever lead to a failure of integrity or to bacterial passage, the customer would not be able to bubble point the filter after use, and consequently the customer wouldn't be able to demonstrate that the filter had remained intact during the filtration.
Another dead end. As valuable as each setback was to the learning experience, the pressure was building.
I think there was no question we were on a learning curve, but we didn't have something we could point to and say, hey, it's right down the road, it's almost done. And frankly, we began to feel some pressure from others within the corporation to say, you know, what's going on here?
Because we were on a crash program. We were utilizing a lot of resources. And we had gone now for 6 months, and we had literally made hundreds of cartridges, and 1 or 2 of them worked. And this is not good odds.
Every day we were meeting with the people who were working in the process, with the R&D people, with the company vice presidents. The communication was extremely rapid and extremely close. Everybody would be visiting our lab several times a day to get the latest results. Whenever anybody had an approach, it would be tried within hours and sometimes days, but usually hours. Samples would arrive in our lab. People on my staff would stay late to test it that night, or we worked 7 days a week for several months to provide rapid response and testing.
As the company marshaled its resources on the Durapore project, the research team came to represent a cross-section of research disciplines: chemistry, biophysics, virology, radiochemistry, biology, and biochemistry, among many. Management concluded that the key to a breakthrough lay in an open atmosphere that allowed everyone to do his own thing.
One of the things we did not do is we did not restrict anybody from doing whatever they thought should be done. In some cases, there were repetitions, but we allowed them to repeat what had been done, but all we did was to inform them that such and such had been done, and for these reasons, we chose not to pursue it, or it didn't work because of. But if you think it's worthwhile, go ahead and do it. Maybe you see something that we didn't see. Maybe there is something different in the way you do it than we did it.
The breakthrough would eventually come from 2 members of Millipore's own infectious disease group. But now, even as the research continued in high gear, Millipore sought yet another alternative. Would an outside consultant be able to break the deadlock? To test this alternative, Mookie flew to New York to visit a firm whose specialty was polymer grafting.
In order to find it, we had to get directions from them to tell the taxi cab how to get there. And then about the last quarter of a mile, the cabbie was cussing and moaning because it's unpaved. We got to the building, and it has any number of doors. We finally walked in and found our way through, and there they were, the grafting specialists. And we presented them with our problem. We told them exactly what we had, and they said, no problem, we have worked with this polymer before. And they even showed us some results, which looked very good. So we hired them to do the work on our filter. But we still couldn't get a consistent product out of them. And after 3 months of that, not having any results and paying them every month, I went down there for what I thought was our last trip. I knew that I was going to cancel it out. We were not getting any results. And I walked in the door with my speech all prepared that you're very nice people, but maybe we should look for another way because it doesn't give us it doesn't give us a product. And they handed me a piece of filter which was snow white, and they put a drop of water on it and it wetted like a charm, and they said this piece had been autoclaved for 2 hours. We solved your problem. You have no problems anymore. Well, the evidence is right there in my hand. The thing works. It's beautiful. Needless to say, I didn't cancel them out. I just extended them for a month and came back up here with the piece in my hand, and we wetted it, and it wetted beautiful, and everybody was very happy. It was Friday. Come Monday, we autoclaved it, and it appropriately died.
While filter development inched forward, the Process Filtration Development Group, working on the cartridge, had its own logjam to break. The answer was at hand. All that was needed was a fresh look at the problem.
Essentially, what we did was to play a little game. And we kind of said, on an individual basis, with each guy who was working on the team, okay, you bet your job. Let's put your job on the line now and say that it's your individual responsibility to make this cartridge and make it work in the next 2 or 3 weeks. How would you make it? What components would you use? How would you put it together? What assembly techniques would you take? What precautions would you take? And also, what do you figure the probability of success would be? And we went through the 4 or 5 guys who were making daily contributions to these things, and we got a remarkable similarity in recommendations. And it kind of said that when all was said and done, we had been learning some things, and that if we took a particular course of action, put them together, then the degree of optimism among each individual was very high. I guess we have to follow that up by saying that we then did what everyone said. We took all the components that people had suggested and put them together in the way that was virtually universally suggested, and the cartridge worked. We made, I don't know what it was, a dozen?
At least, yeah, in that neighborhood.
And suddenly we began to have success, and the cartridge would maintain integrity through thermal sterilization and through pretty strenuous hydraulic stress levels, so that we began to feel, hey, maybe this really is paying off.
It was in late summer of '77 that we made those 12 cartridges that worked. And as Pete mentioned, then we went into the area of developing the processes by which we could make more than a dozen cartridges, make 10s and 20s, and do it over and over again. And we began to subject these cartridges to passage test, where we actually challenged them with bacteria and measured their performance, now how they were going to be used in the marketplace.
The cartridge element did not perform quite as expected. It did not perform in the same way that the membrane, flat stock membrane material performed. And that really isn't surprising when you consider how much goes into making a cartridge. I mean, there's all kinds of things that happen to it, the pleating and the this and the that, and it's just an amazing amount of things that go into manufacturing cartridge. So it was no surprise that it did not perform quite the same, given that it was a prototype model. So the corporation was faced with a decision. Well, we have a product that we can make. We have a cartridge which, to the best of our knowledge, does remove bacteria, but doesn't do it quite as well as we're used to having our filters remove bacteria. We're used to removal abilities around 10 to the 10th or greater. In other words, no passage detected under the test conditions that we employ. We now have a product in hand which was pretty efficient. It removed, I don't know, 10 to the 6th, 10 to the 8th organisms, but didn't quite meet up to our usual standards on sterilizing filtration products. So we were faced with a decision. What do we do? Do we decide to make a claim saying that it only holds back 10 to the 8th, 10 to the 6th, and go with the product as is, or do we try to make it better? The decision was, let's make it better.
The polymer seemed intractable. Each solution to one problem brought new problems with it. But there were many players and a lot of cards on the table. And Chuck Beer, who had been working closely with Mookie on the project, now thought he saw a way of playing a couple of those cards to make the score.
Well, at the time, Alan Ephraimson was working on the VMF2 process, and he got it to a point where it looked like it could be made into a commercially feasible continuous process. I was particularly impressed with the degree of control he had over it, and he could just about get any degree of reaction that he wanted to. And I said to myself, if I could graft this membrane, we really would have something. So I took the technology that the outside consulting firm gave us, and I modified it for this change in substrate. And Doug Boucher and I did the initial experiments on it, and we found that indeed we got a very good degree of grafting and very low extractables. We couldn't wash the grafted coating off even with boiling methanol. It looked very good at this time, and I was quite excited. I told Mookie about it, and we decided that we really didn't have enough manpower to push two leads. This new lead, which we called VMF3 because it was really a takeoff on VMF2, as well as the work that the outside consulting firm gave us. So what I did was I followed up the work on the outside that the outside firm gave us, along with another technician, and two people in George Christopherson's group took on the VMF3 experiments. Now, I provided some technical support at the time, but we really didn't know very much about it. The people were Donna Beckwith and Marcia Stein.
Marcia Stein is a radiochemist, but she was the one to conduct the experiment that signaled success.
I think I was working alone. It was a day like any other day, you know, never expecting any great success. I had been trying different combinations of polymers and varying the ratios of those polymers to determine what kind of effect that would have on the flexibility and wettability of the filters. And one particular polymer looked very good, and as I increased the proportion of that polymer in the grafting solution, the filters began to look better and better. So at the end of the day, I tried a solution of 100% that polymer, and I put the test filters into a 293 holder and sent them off to the autoclave. I think I came in the next morning. We had the 293 holders waiting to be opened and tested. I tested them then, which the test consisted of taking the filter out and putting it in water and seeing if it would wet or not, and how quickly it would wet. Because some of these polymers would allow the filter to wet, but it would take a certain period of time, up to a minute, sometimes 2 minutes, and that was considered not to be an advantage. This particular polymer wet instantly. It was just like a flash. It wet much faster than any of the others we had tried, and the filter itself was more flexible, and it never did become brittle.
The fundamental research problems were now solved. Millipore had a polymer whose essential nature was hydrophobic and yet presented a hydrophilic face to the world. It had a filter material that would stand up to heat and the autoclave and remain wettable and integral. That could be bubble pointed, that would retain critical microorganisms, that was rugged, that could be formed into convenient cartridges with high surface areas, that could take all that a pharmaceutical manufacturing process might throw at it, that was makeable on a consistent basis, and which held out promise for new, unique, and useful products for the future. Now the focus shifted to scaling up the research developments into large-scale production processes that would meet demanding quality control standards. New faces entered the picture. Tony Arrigo and Marty Hirsch, who would oversee the scale-up. Dave McAllister, who would be responsible for the quality of outgoing product. Bill McDonald, who helped manage the testing process, which honed down the flaws, and dozens of others, all directing Durapore toward kickoff day.
We developed a test list and began testing each lot of cartridges very extensively. The key tests again turned out to be live steam and autoclaving the cartridges. We again found a succession of problems, and each time would work very closely with the production and manufacturing engineering people and R&D people to identify the causes of the problems and to solve them.
we ran the first 2 lots, and they were tested quite vigorously, and everything went fine, you know, and we were kind of pleased, and we thought we were going to walk through the thing. And then the next lot, and I recall it was on a Friday night, and Monty and I have a thing about Friday nights.
All the information.
Someone came up, well, it was someone from the IRS group that advised us. There was 2 failures, I think, in a lot. And some of us were a little bit dejected, but actually that presented the opportunity to get into the defect analysis, which is the key, is really the heart in solving any type of production problem. Well, I guess design problems also. So that the following morning, which was a Saturday morning, the IRS group was in, and we got together and we set up this autopsy team. And Monday morning, when we opened them up, we found that we understood what caused the failure, and we could prevent it through better control, closer supervision, training, AV tapes, and so forth. And I think that kind of relieved a lot of people's minds and kind of set the direction, you know, of the scientific approach to the refinement of the process. So that which ostensibly looked like, you know, maybe it was going to be a downer, was a real opportunity.
There was a task force set up that was chaired by Marty Hirsch, and this task force met at least once a week. And as we generated data from a given lot, we would report this information to the task force. Additionally, 3 times a week, we had a sub-task force meeting that was chaired by Dick Schaffner. And it was at these meetings that we also transmitted the information that we had gathered, problems that might have existed or results that were pertinent to the continued success of this project.
Essentially, you know, you got a system, and you have a task force, and all the components in this place, all the resources have to fall in line to understand the particular problem and process. And when you have all those things focusing in on one thing, it's just like a process. The people of the process here. And you can see the forward movement. One group is a little heavier and then gets lighter, and another one picks it up. But they're all up to date, and it's kind of an action team.
Well, it's a pretty close working relationship. You know, we just don't work by ourselves. So when we see such a problem, whether manufacturing sees it or we see it, it's we'll get the group together again and say, now here's the defect we found. Here's where we found it. And it's with all these lot numbers of materials, because we keep very close track of all of our lot numbers of the components and everything that went into making this cartridge up, or this Durapore cartridge. Once we had dissected and looked at failure modes and corrected failure modes to where we knew that our process and our design was good, that it did what we said it wanted to do, then we made 10 lots of materials. Now, that's probably in line with and probably in excess at times of what a pharmaceutical manufacturer would do. We made 10 consecutive lots of cartridges and said, if these 10 lots all produce the same cartridge and the data is all reproducible, and if it's within specs, we have a product. If they're not within specs, and if we get a blip in there that says, well, the first 2 or 3 were okay, but now this one's not too good, and next 2 or 3 are okay, but now this one doesn't meet specs, then we don't have a product, because our process isn't capable of giving us that design that we said we had to have. Well, it turned out we produced many lots, but we finally got 10 lots that did what we wanted them to do. And after reviewing all of our data and saying, gee, our elongation's okay, tensils are okay, it's strong enough, it's autoclavable, you can steam sterilize it, and it holds 10 to the 10th Pseudomonas bacteria without passing any of them through the filter, then we felt that we had our product, that we had lots that were qualified, that it would do the job time after time after time. And that's a quality product.
The process of researching and developing a new product is commonly thought to be the straightforward pursuit of a well-defined goal. Indeed, understanding the process often requires that it be stripped of its complexity and presented in a straightforward, logical manner. But the real-world process often defies logic. Goals are an arrangement of priorities, a selective choice among compromises, and pursuit is like tracing a maze or running an obstacle course. It requires a commitment to pursue the goal and a marshaling of resources, most of all people, to reach it. Durapore and its search for a polymer that would merge two distinct personalities is only one example of the principle.
But I think the next obvious question that we have to ask ourselves is, given that there's a whole bunch of things that happen in the marketplace, there's a whole bunch of different situations that the product is going to see, different kinds of solutions, different levels of organisms, different types of operators, all kinds of variables that it's difficult for us to control. It's time now to see if the material works in the marketplace. We've given it our best shot in terms of evaluating the product, and I think it's time now to get some customer feedback, and that's probably the most exciting prospect of the whole thing, is to have the thing finally get in the marketplace, get people to try to use it, and to see if it really does perform as well as we think it performs.